Hello, everyone. Concord has asked me to present a course in an area that I have worked in for many years, that of allergic reactions. This is an area that, well, as a microbiologist and an immunologist, I've had the opportunity to see a number of allergic reactions. We have worked in these areas with research when I was in the lab and in the hospital and in the dental school. One of the things to keep in mind at the outset here is we are becoming a much more allergic population. Many of you probably listening to this right now know someone who has at least one or multiple allergies. When we look at what's going on clinically, for example, in your practices and in your clinics, you are seeing more and more patients coming in with numbers of allergic reactions, which could compromise some of the treatments or alter some of the treatments that maybe had originally been proposed. In addition, there are a variety of materials in dental practice that can cause allergic reactions. The course that I have done now for a number of years that I continue to update will provide background as to what an allergic reaction is versus normal immune responses, classify the different types of clinical reactions with examples, of course, and go through some of the mechanisms. This course will also have a number of clinical photos and clinical pictures. Some ones that I've seen, others from colleagues that they've been asked me to, that they've allowed me to use, etc. We will talk about mechanisms of these. We'll also look at some of the emerging things that came out a while ago and that are continuing to emerge. A big one, for example, was in the 1980s, early 90s, about latex allergies. And so some of you, for example, may be latex allergic, but I know you've had patients that are latex allergic. It's still an issue, not as much as it was in the beginning, because now we have much more use of non-latex items, but we're going to be going through latex allergies, some of the other emerging allergic patterns that we're seeing that can cross-react with some materials that maybe are being used. So this provides, hopefully, for you a comprehensive overview of what allergies are, what allergies aren't, representative examples, mechanisms, and some of the ongoing issues that we're seeing with allergies in the general population and in health professionals.